Can you remember the last time you got out of bed and just stood up? No wincing, no grabbing the nightstand, no waiting for your knees to warm up before you could walk to the bathroom. For many of you over 60, that simple act of standing up in the morning has become a daily negotiation with your own body. You swing your legs over the side of the bed, and the moment your feet hit the floor, your knees feel like they belong to someone 20 years older. They're stiff, they're achy, they creak like an old wooden door, and here is what breaks my heart. So many people accept this as normal. They tell themselves, well, I'm getting older. This is just how it is now. But I'm here to tell you something important today. That morning stiffness, that aching, that feeling like your knees need 30 minutes to wake up. It is not a life sentence. It is a signal. Your knees are telling you they need attention. And the best time to give them that attention is the moment you open your eyes. Today, I'm going to teach you 5 gentle exercises you can do every single morning. You don't need any equipment. You don't need to get on the floor. In fact, you are going to start the first 2 exercises right there in your bed before your feet even touch the ground. We are counting down from exercise number 5 to number 1. And I saved the most powerful one for last because it targets the one muscle that almost everyone ignores, and it is the key to making your knees feel a decade younger. But that is not all. After the exercises, stay with me because I'm going to share a bonus morning protocol. It is a 60-second habit that lubricates your joints from the inside out. Think of it as oiling a rusty hinge. It is simple, it is free, and it works from your very first morning. So, let's get started. Let's begin with exercise number 5, the bed heel slide. We are starting gentle and we are starting smart. You just woke up. Your body has been still for 7 or 8 hours. Your joints are cold. Your synovial fluid, the natural lubricant inside your knee, has thickened overnight. Imagine honey sitting in the fridge. It gets thick and sluggish. That is what happened inside your knee while you slept. We need to warm that fluid up before we ask our knees to bear any weight. Here's what you do. Stay lying on your back in bed. Keep one leg straight. Now with your other leg, slowly bend the knee by sliding your heel along the mattress toward your buttock. Slide it as far as feels comfortable. You should feel a gentle stretch, not pain. Then slowly slide it back out until the leg is straight again. The mattress is your best friend here. It supports your leg and reduces friction, so there is almost no load on the knee joint. You are simply moving the joint through its range of motion, gently pumping that synovial fluid so it becomes warm and slippery again. Let's do this together. Right heel sliding in toward you. Feel the knee bending. Go only as far as it feels comfortable. And now slide it back out. Smooth and controlled. No jerking. Now the left heel. Slide it in. Feel the gentle motion in the knee. And slide it back out. Here is an important tip. Do not try to force your heel all the way to your buttock. If your knee only bends halfway, that is perfectly fine. Every morning will be slightly different. Some days you will have more range, some days less. Listen to your body. The goal is motion, not depth. Do this 10 times on each leg. It should take you about 2 minutes. By the time you finish, you will already notice that your knees feel looser, warmer, more willing to cooperate. And we haven't even gotten out of bed yet. Moving on to exercise number 4, we are still in bed. This one is called the lying quad set. Now, your quadriceps is the large muscle on the front of your thigh. It is the primary muscle that supports and protects your knee joint. When this muscle is strong and engaged, it acts like a natural knee brace. When it is weak or inactive, your knee takes all the punishment. Here is the problem. After a night of sleep, your quad is essentially switched off. It is sleeping just like you were. If you stand up and walk on a sleeping quad, your knee joint absorbs all the impact. That is why those first steps in the morning hurt the most. We need to wake this muscle up before we stand. Stay on your back. Keep your legs straight. Now, I want you to push the back of your knee down into the mattress. You should feel the muscle on the front of your thigh tighten and harden. If you place your hand on your thigh, you will feel it contract. Hold that squeeze for 5 seconds. 1, 2, 3, 4, 5, and relax. That is one repetition. Let me explain what just happened. By pushing your knee into the mattress, you activated your quadriceps without bending the knee at all. This is called an isometric contraction. The muscle works, but the joint doesn't move. It is the safest, gentlest way to wake up the muscle, even if you have arthritis or a knee replacement. Let's do another one. Push down. Squeeze. Feel the front of your thigh tighten. Hold it. 2, 3, 4, 5, and release. When you release, really let go. Feel the muscles soften completely. Do 10 repetitions on each leg. Here is a common mistake. Some people hold their breath while they squeeze. Please don't do that. Breathe normally. Inhale, then squeeze on the exhale. Your brain needs oxygen, especially first thing in the morning. Your quad is now awake. It is ready to protect your knee when you stand up. But first, we have 3 more exercises to go. My friends, before we continue, I have a small favor to ask. If you are finding this helpful, or if you know someone who struggles with morning knee stiffness, please take a moment to click the like button and subscribe to the channel. Your click helps this video reach other seniors who need these exercises. Thank you so much, and let's keep going. Now we are going to sit up. Swing your legs over the side of the bed. This is exercise number 3, the seated knee extension. Sit on the edge of your bed or on a sturdy chair. Your feet should be flat on the floor. Sit up tall. Now slowly straighten your right leg out in front of you. Extend it until your knee is as straight as you can comfortably get it. Point your toes slightly toward the ceiling. You should feel your quad working hard. Hold this position for 3 seconds. Then slowly lower your foot back to the floor. Do not just drop it. Control the descent. Lowering slowly is actually more beneficial for the muscle than lifting. When you sit with your feet on the floor and then straighten your leg, you are working your quadriceps through its full range of motion under a very light load, just the weight of your lower leg. This builds what we call functional strength. It mimics the exact motion you need for walking, for climbing stairs, and for getting up from a chair. Let's do this together. Right leg extending out. Straighten it. Feel the quad squeeze at the top. Hold. 2, 3. Now slowly lower it back down. Resist gravity. Don't let it just fall. Good. Now the left leg. Extend, straighten, hold it there. Feel the muscle on the front of your thigh working and slowly bring it down. Here is a key detail. At the very top of the extension, when your leg is straight, I want you to give your quad one extra squeeze. Pull your kneecap upward by tightening the muscle as hard as you can for just 1 second. This extra squeeze at the top is what physical therapists call a terminal knee extension, and it targets the part of the quadriceps that weakens the fastest as we age. It is the part that matters most for knee stability. Do 10 repetitions on each leg. If one knee is stiffer or more painful than the other, start with the better knee first. This warms up your body and gives the stiffer knee a little extra time. Exercise number 2, the standing knee circles. Now we are standing, but don't worry, this is very gentle. We are going to lubricate the knee joint in a way that no straight line exercise can. Stand near a wall or the back of a chair for support. Place your feet together. Now bend your knees slightly, just a few inches. Place both hands on top of your kneecaps. You're going to make slow, smooth circles with your knees. Move them to the right, forward, to the left, and back like you are stirring a pot with your knees. Let me show you the motion. Hands on the knees. Small circles to the right. Keep the circles small. We are not doing deep squats. We are doing gentle rotations. Feel how the joint moves in all directions. Your cartilage is getting compressed and released from every angle, spreading that synovial fluid everywhere it needs to go. Do 10 circles to the right, then reverse direction. 10 circles to the left. Now, here is the detail that makes this exercise truly effective. As you circle, pay attention to any spot in the rotation that feels stiff or clicky. That is the area that needs the most lubrication. When you find that spot, slow down even more. Spend extra time there. Don't avoid it. Gently work through it. Over the course of a few days, you will notice that click or stiffness starts to fade. One important caution: if you've had a meniscus tear or your doctor has told you to avoid rotational movements, please skip this exercise and simply double the repetitions of exercise number 3 instead. For everyone else, this is one of the most underrated exercises for knee health. And now we arrive at exercise number 1. This is the exercise that ties everything together. It is called the walls supported mini squat with an isometric hold. This exercise targets the one muscle group that almost everyone over 60 has allowed to fall asleep, the VMO, the vastus medialis oblique. This is the teardrop-shaped muscle on the inner side of your knee just above the kneecap. When this muscle is weak, your kneecap tracks improperly. It drifts to the outside when you walk or climb stairs, grinding against the bone. This misalignment is one of the most common causes of knee pain in seniors. Strengthening the VMO pulls the kneecap back into its proper groove and the pain decreases dramatically. Here is how we do it. Stand with your back flat against a wall. Your feet should be about 1 ft away from the wall. Place them shoulder width apart. Now slowly slide your back down the wall, bending your knees. But here is the critical instruction. Do not go deep. I want you to stop when your knees are bent to about 30 degrees. That is a very slight bend. If you imagine a clock, your thighs would be pointing to roughly the 11:0 position, not even close to a sitting position. Why so shallow? Because the VMO is most active in the first 30 degrees of knee bend. If you go deeper, the larger quad muscles take over and the VMO gets lazy again. We want to isolate that inner muscle. Now, hold this position, press your back firmly into the wall, squeeze your thighs, especially the inner part just above the kneecap. Hold for 10 seconds. Feel the burn. That is your VMO waking up. It might tremble. That is normal. It has probably been underworked for years. Let's count together. Press into the wall. Squeeze. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now slowly slide back up to standing. Shake out your legs. Take a breath. If you do not have a smooth wall or if standing against the wall is uncomfortable for your back, here is the modification. Stand behind a sturdy chair holding the back for support. Bend your knees to that same 30 degrees angle and hold. The wall just gives you something to lean against. The chair version works just as well for the VMO. Congratulations, you have just completed the full morning knee routine. It should take you about 8 to 10 minutes once you get the flow. But before you walk out of your bedroom, I promised you a bonus, the 60-second morning joint protocol. This is something you do immediately after the exercises, and it acts as a force multiplier. Here is the secret. Your knee cartilage has no blood supply of its own. Let me say that again because it is incredibly important. Unlike your muscles, which have arteries and veins delivering blood directly, your cartilage relies entirely on synovial fluid for its nutrition. And synovial fluid only moves when the joint moves. That is why our exercises matter so much. But there is a second factor: hydration. After 7 or 8 hours of sleep, your body is dehydrated. Your synovial fluid is thicker. Your cartilage has been sitting in reduced fluid all night. The exercises get the fluid moving, but we also need to replenish it. Here is the protocol. As soon as you finish the exercises, drink 1 full glass of room temperature water, not ice cold. Room temperature water is absorbed faster by your stomach. Then, while you drink, do 10 slow, full ankle circles with each foot. This keeps the lower body circulation active while the hydration enters your system. That is it. Water and ankle circles. 60 seconds. Your joints will thank you. Let me give you the complete morning sequence so you can follow it easily. The moment you wake up while still lying in bed, start with exercise 5, the bed heel slides, 10 on each side. Then exercise 4, the lying quad sets, 10 on each side. These 2 exercises take about 4 minutes total, and they prepare your knees for weight bearing. Next, sit on the edge of the bed. Exercise 3, the seated knee extensions, 10 on each side. This activates your quads through their full range. Now, stand up. You should already feel the difference. Exercise 2, the standing knee circles, 10 in each direction. This lubricates the joint from every angle. Finally, exercise 1, the walls supported mini squat with isometric hold, 5 holds of 10 seconds each. This wakes up the VMO, the most important muscle for knee stability. Finish with the bonus protocol, 1 glass of room temperature water and 10 ankle circles each foot. My friends, I know that when something hurts every morning, it is easy to lose hope. It is easy to think that the best days are behind you, but I see it every single day. People in their 60s, 70s, and 80s who started with stiff, painful knees, and within just 2 or 3 weeks of this routine, they are walking with confidence again. They are taking the stairs instead of the elevator. They are playing with their grandchildren on the floor. Your knees are not broken. They are just neglected. And starting tomorrow morning, that changes. Here's my challenge to you. Try this routine for 7 mornings in a row. Just 7. Mark it on your calendar. And after those 7 days, I want you to come back to this video and tell me how you feel in the comments below. Tell me, did the stiffness reduce? Did you notice a difference by day 3 or day 4? I read every single comment, and your progress motivates other people who are just starting. If you found this helpful, please hit that like button. It helps this video reach other seniors who are waking up every morning in pain and don't know there is a solution. And if you haven't subscribed yet, please join our community. We post new practical health guides every week. I wish you a pain-free morning and a wonderful day ahead. Take care of your knees and they will take care of you. I will see you in the next